Welcome to All Things Moore County, Moore County's weekly radio show highlighting the many facets of the Sandhills. That includes real estate, lifestyle, community and neighborhoods. And now from 4 Properties, here's your host, Bill Sahadi.
Good morning and welcome to the talk show, All Things Moore County. Dorothy, every show I think I always start by talking to you, don't I?
Yeah, I think so, just about.
It's a natural lead-in and it kind of makes it easy.
Yeah.
You know, we had a show last week with Lowell Simon, who is a Democratic candidate for the House of Representatives. Mm-hmm. And we talked a little bit on the show about social media and headlines and news and how we get saturated with all sorts of headlines.
We're bombarded by news.
Yeah, and in his case, it was all political.
Right.
But every morning you wake up, you go online, and there's always one headline after another, breaking news this, breaking news that.
Yes, that's the new popular word, breaking news.
And we get saturated with information, or some people would say misinformation. But I've always been amazed, amidst all the headlines and the news and the banter of the day. You know, just this year, I went on to my homepage, and right below all the headline news, you know, there was an article that Anthony Bourdain, who was the well-known TV host of a show,
Great show.
He had committed suicide.
Yeah.
And a few weeks earlier, a New York handbag designer, Kate Spade.
Actually, they were days apart, I thought.
Yeah, maybe you're right. It was closer than just...
They were like the same weeks, but still, 2 very famous people committed suicide.
Yeah, Robin Williams a couple years earlier. And people get so drawn to that.
Yeah.
And almost in maybe an over-sensationalized way, I'm not sure, but I guess I'm laying the groundwork for introducing my guest today, Dr. Meredith Stanton. She's a staff psychiatrist at First Health, and she talks about all about the suicide, the prevention, some of the causes, the misunderstandings and misperceptions, the people left behind, and it's not a topic that you generally have a conversation about, but probably one that would be very important.
Yeah.
Meredith, I just want to say good morning, and in reading a lot about you, you are kind of new to Moore County. You moved here in June of 2016.
That's correct.
And you are a psychiatrist practicing.
Yes.
Originally from Atlanta.
Yep.
How'd you get here?
So my husband is active duty Army officer,
Right.
and we were stationed at Shaw Air Force Base in South Carolina, and we were fortunate enough to be able to be stationed here at Fort Bragg and chose Moore County as our place to live, like a lot of other military families.
When we spoke on the phone last week, I heard the banter of some children in the background, and when I was first introduced to you, I thought you were going to be older.
Well, thank you. I appreciate that.
Yeah, and I don't know why I associate that with somebody older, but how old are your kids?
I have 2 boys, and they are 8 and 5.
Wow.
So.
Okay, so you are you're here for the long haul, do you think? Do you hope?
Hopefully, yeah. We really enjoy Pinehurst and Moore County, and hopefully the Army will be good to us and let us stay for as long as possible.
Were you planning, when you knew you were moving here, had you been in touch with First Health? Was this something that you had a job knowing when you were going to get here?
Yes, so I did my own recruiting and called First Health, and I really liked what the hospital represented in the organization, and it was a nice change of pace from private practice, and I have to say it's very fun and challenging.
You did your residency at Emory?
Yes.
So you stayed kind of close to home for that.
For that, yes, but I also really have a lot of pride with Emory, and especially my experience there doing inner city psychiatry versus VA versus academic medicine.
I didn't know that suicide was the 10th leading. As a matter of fact, I don't know a lot about the topic you're going to speak about. So if I ask a question, it's certainly going to be a layman's question.
Of course.
But suicide is the 10th leading cause of death in the United States?
Yes, I think that people misunderstand that suicide is more prevalent than homicide.
That's crazy.
Almost 2-to-1 ratio. And I think the reason why is because homicide is reported more in the news media.
Right.
And suicide tends to be underreported, especially depending upon where people are regionally, because it's one of these taboo topics that families and certain, churches, they don't want to admit that they have people that have died by suicide.
As a layman, I remember going back to the days of Jack Kevorkian.
Oh my gosh, yes.
Remember?
Well, I think I'm not going to say how old I was during that
Don't
time period.
tell me 'cause you'll make me feel really old. But the media portrays, he did assisted suicide.
Correct.
And he got a lot of press and almost became like a subculture, almost hero in a way. Does the news do us a favor by the way they report suicides?
It really depends, especially when they talk about gruesome details of the suicide of famous people. There can be a phenomenon called copycat suicide, where people think, oh, this is a great solution because this famous person that I look up to did it, so it's okay for me to do it.
Right.
Versus talking about ways in which we can prevent and also seeing the signs in loved ones so that we can kind of reach out to individuals within our community.
People always look back, and do they always feel guilty when there's a suicide that happens? What were the signs that they missed? How could we have missed this? There's a lot of guilt.
Well, I think absolutely. There's a lot of grief when it comes to death in general, and especially with suicide.
Right.
But my biggest takeaway is that it's no one silver bullet cause of suicide. It's really multifactorial. And that it's even hard for us as psychiatrists and mental health providers to really do a good risk analysis, because the people who don't want to talk about it are the ones that I worry about the most.
Right. In your practice, are you identifying people who have signs? Tell me a little bit about your practice, how it's structured, and what it is you're trying to do.
Sure. So I work in 2 different capacities at First Health, and probably the area in which I am exposed to the most amount of suicide risk assessments is in the emergency room, because I do emergency room and consult liaison psychiatry. So any person who comes through the ER
Right.
who has a complaint of suicidal thoughts has to be evaluated by a physician, advanced practitioner, or a mental health provider. And it's really hard because there's different levels of suicide, and that's where I think we need to kind of clarify that for a lot of people, is that you can have suicidal thoughts,
Right.
and there's different severities of those thoughts.
Right.
So a lot of individuals, and I also want to point out that suicide is a symptom of a larger illness. So just because you have thoughts of wanting to die does not mean you're mentally ill. It just means that you probably have some depression, anxiety, substance abuse going on as well. So when patients come in, we have to assess, when do these thoughts start? How intense are the thoughts? Have you thought, is it just one of these kind of passive thoughts where you think, oh, I wish I could fall asleep and never wake up?
Right.
Or are you actually formulating a plan? And I actually have, unfortunately, I have a lot of teenagers or adolescents who come in who make those statements, I wish I were never born, or I wish I could die. And those are more reactionary statements, but it's still important for myself and my colleagues to be able to get to the underlying issue of why they would actually even say those things.
As teenagers, those are Are those more identity crisis issues in growing up, or that's what you have to discern, right?
Yes, and a lot of times teenagers will say these things because they might not have the right vocabulary to express their own emotions, because you have to learn how to talk about your emotions like you learn to speak Spanish. It's not something that's always innate within a home or parents, and I think that's something that we as adults, we assume that they look like adults, so they emotionally and cognitively think like adults. But teenagers are still irrational and very impulsive. And they just have to learn also coping, is that's a risk factor for suicide, is that if you don't know how to solve a problem, it feels insurmountable and overwhelming. So I might as well give up. And I think that's where we as a community can really help our young adults and our adolescents to really figure out good coping skills, to be able to face all the stress that is in life that we cannot avoid.
You mentioned mood, you mentioned depression, you mentioned drugs. Are there specific common denominators that you are looking for when you're assessing somebody? Because it's not just one thing, is it?
Absolutely. It is so many different factors and facets of an individual. I think the thing that was most fascinating for me is the week that Kate Spade and Anthony Bourdain died, the CDC came out with their vital statistics about increased suicide rate within the United States. That there was a 30% increase from 2000, let me make sure I say it correctly, 1999 to 2016 in over 27 states. The biggest thing that they noticed is that 54% of those individuals that had completed suicide did not have any known mental health history. And it kind of shows us that they might not have been treated for mental health, but they probably had a lot of symptoms that they were not taking care of or not handling well. And depression, anxiety, and substance abuse are key factors in that.
You mentioned that the largest increase was in the adult age group, 45 to 64.
Yes.
I don't understand that.
So what age group do you think would have the highest suicide rate, if you could just guess?
I would think the younger age, in the 20s, 30s, maybe people who haven't been able to get over the hump of growing up. I don't know.
That's what we used to think, but new statistics has shown that the highest rate of increase is this middle-age population, especially males and Caucasian males. Now, they're still going through the research to figure out why, but some of the theories have to do with the economic downturn that has recently plagued. And also, people envision their life as being a certain way, and then when it doesn't turn out to be that way, there's a lot of disappointment and hopelessness. And also, intimate partner and conflict within a relationship are a huge factor within it.
People, again, I'm a layman. People meet with distress, disappointment in life. People try to cope and accommodate, but suicide seems like such an extreme reaction. And you're looking at me like, I'm a layman. People have to adjust and get over it, but some people don't have the self-esteem.
I think it goes back to multiple causes. One is that we know that there's a high prevalence of mood disorders that run in families. And also there is a genetic component to that.
Okay.
But also think about this, is that if you have family members that have committed suicide, you're at a higher risk of doing that yourself, because it seems like an option. They're like, oh, well, I did okay after my mom died, so maybe my kids will be fine. There also is that adverse childhood events can really shape and form adults. So abuse, neglect, chaotic experiences where you don't learn how to cope in healthy ways. Divorce, a parent addicted to drugs, a parent incarcerated, all of these things form individuals. And if they don't have a good, stable family life or outlets to get help, especially mental health help, then it's a higher chance too later in life.
Is the economic component of suicide very easy to see? Is it the poor or the less advantaged people?
Absolutely, because then if they lose housing, if they lose jobs, they don't have that financial security that people who are middle income do, to be able to not work for a few weeks to months to years. And I think that's where, as a community, if we can help transition folks into being more financially stable in a government standpoint. Now, I am neutral when it comes to my political stance.
Dorothy, did you hear that? Isn't that refreshing?
Very refreshing.
Oh my gosh, thank you for saying that.
But I understand a lot of social dynamics, and that having those resources available can absolutely reduce suicide rate and also mental health burden.
Let's come back in the second set. I want to talk specifically about North Carolina and trends in Moore County.
Sure.
And we're speaking with Dr. Meredith Stanton. She's a psychiatrist at First Health. This is All Things Moore County. We'll be right back.
Oh, it is.
Welcome back to our second set of All Things Moore County. Our guest for the entire show is Dr. Meredith Stanton. Very well spoken, by the way, I have to say.
Oh, thank you.
And calming and soothing, and we were saying you have an NPR radio voice. You tell your husband I said that, and it's going to be obvious to anyone who listens to you. So our topic is not something we all talk about a lot, which is suicide. And we were starting to talk a little bit about the some of the common denominators of suicide and some of the trends, or we hadn't really gotten into the trends yet in the state of North Carolina, and in particular, Moore County.
Correct.
Would love to get your take on that.
So North Carolina, based upon the CDC vital statistics that came out in June, had a increase of 12.6% in the rate of suicide per 100,000 from 1999 to 2016. That is not the highest within the United States. Montana is one of the highest. It had an increase of 38.9. And Nevada always consistently stays pretty high. And the reason why is that access to firearms play a significant role in the completion of suicide because of the lethality of firearms versus suffocation versus
hanging
versus poisoning.
Mm-hmm.
And so for states that have a more, shall we say, a higher access, so less lenient gun restriction laws, and that tends to be the Rocky Mountain states. Alaska, those have the highest suicide by gunfire, because you can complete suicide by gunfire more successfully than you can with suffocation or with poisoning. And for every completed suicide, there's 30 to 40 attempts.
Could you say that again?
For every completed suicide, there's 30 to 40 attempts. So the rate of attempt in the United States is very, very high.
Somebody who commits suicide will have tried it 30 to 40. Is that
Not
what you're saying?
Not necessarily 30 to 40 times, but they will have prior attempts.
Okay.
So people who actually complete have had a history of attempting in the past, and that can vary dependent upon the individual. And the theory is, or the understanding is that if they're not afraid to try, they're going to try when they're really desperate to do more and more things that could cause more and more harm. So they will up the ante, if you will.
You know, just last evening, I finally got home and I turned on the TV. This is a true story. And I was watching a movie. It was a movie I really liked called Jersey Boys.
Yes.
Did you see it? Oh, the play?
Yes, I actually saw that in Atlanta. Yeah.
Great play. And it was a story about the Four Seasons.
Mm-hmm.
And they emanated from northern New Jersey in the 50s and the 60s. Well, the way the movie treated Frankie Valli's daughter's suicide was probably typically Hollywood, where she was estranged from her father, had an alcoholic mother, as the movie depicted it, and had a very bad influence with a boyfriend/bum who was a bad influence on her, and she popped some pills, and they kind of glossed over it, and he sort of made a comeback, but it was the reason why he wrote one particular song, "My Eyes Adore You."
Yes.
You heard that?
Oh, I could sing it, but I'm not going to.
Okay. And I thought to myself, and I knew I was going to come in and speak with you this morning, and you saw his guilt, and his partner, Bob Gaudio, said to him in a diner, I guess a few weeks later, he said, "It was not your fault." And in the movie, Frankie Valli said, "Whose fault was it?" The aftermath, I guess, of a suicide reaps havoc on people's their guilt, their responsibility, and it's something they carry with them forever.
Yes, and we call them suicide survivors.
Yeah.
Because they're the family and friends who have unresolved questions about, what could they have done differently? How could they have helped? How did they not see it? And a lot of times there are some warning signs that can play out, that the hopelessness, the isolation that a lot of patients or family members will notice about my patients in particular. And a lot of times they'll increase their substances, they'll start drinking more. So we know that there's a high correlation of alcohol intoxication with completion of suicide. Alcohol makes us more impulsive, so we're more likely to complete tasks that we wouldn't normally do if we weren't inebriated.
Do many suicides happen when people are intoxicated?
About, if I remember, I think it's like around 48% when they do toxicology screenings have alcohol in their system, and that doesn't include like sedatives or opioids, which play a factor as well. But if you think about it, suicide tends to be a very rash and impulsive decision at times. And so people will do more rash and impulsive things. And then having access to a firearm, they're more likely to hurt themselves in lethal means.
It's not very cut and dry, and it's not so simple.
No.
But again, as a layman, doesn't everything seem to emanate from a person's self-esteem?
That's a very Freudian question about our own self-image and worth. But I think that it plays a factor into, do you feel confident enough to be able to solve your own problems and have hope within yourself?
Okay.
That's where I think the self-esteem can play a factor into it. But I also think relationships, connectivity play a factor as well. So there's internal and external drivers for suicide. I think so in Moore County, the suicide rate is higher than the state. So the state suicide rate is 12.7 per 100,000. Moore County is at 15.6. Now, per 100,000.
Wow.
Guess what our homicide rate is for Moore County?
You're going to tell me less than 15%.
You're right. It is 5.8. And this was in 2015 was the homicide rate. So in a lot of ways, we talk about homicide more than we talk about the suicide that occurs within our community.
Right.
And we are the third highest county in the state of North Carolina for our suicide rate. The ones that are higher would be Stanley and Carteret. Did I say that county right?
Yeah.
Yeah, with 18.6 and 17.7.
Spoken like a North Carolinian.
Trying.
Why isn't there more publicity? Why isn't there more information in the public about what you're talking about?
Well, I think mental health is a very taboo subject based upon culture and spiritual beliefs that if we cannot cure ourselves in our own ways, then we must be broken, we must be unfixable, or it's not the most glamorous illness to talk about. I mean, the amount of money that pours into breast cancer research versus depression and bipolar is so low, and not many celebrities want to be a spokesperson for their depression or bipolar. So it's a very, and a lot of family members don't want to admit because it's a hidden illness. They look okay from the outside, but they're not able to function.
Not unlike alcoholism.
Correct.
We've had groups on in the past, part of AA, and people are now seeming to come out more in the open about it, to talk about it, the steps to curing and the strength of surrounding yourself with other people in the same situation.
Yes, and I think that Moore County definitely has a substance abuse problem that is increasing and we know is on the rise. I think social alcoholism, especially later in life, when you have certain communities that promote it, can make it very dangerous for people who are vulnerable to becoming alcoholics. Some people can genetically control it and don't have problems, others do not. And it's hard for us to say, hey, let me go to this fundraiser, but I'm not drinking today. Or also we use it as a way to cope that is unhealthy. We have a stressful day, so we go and we celebrate and might have one too many.
I'm thinking, based on something you said in the first segment, I can now understand why the largest increase in the population for suicide is 45 to 64, because that's where the reality of broken dreams set in. That's where you're not growing up anymore.
Yes.
You've arrived, and now here is where you are.
Yes, this is my life.
This is my life.
This is it. This is as good as it gets.
Right. But you don't have that as a child, because the world is your oyster, and you're just going to keep going out until you bump your knees enough when you realize you get settled in somewhere. And in Moore County, you're living in an area where there is wealth and there is poverty, all within a couple of square miles of one another. There are measuring sticks that people use, I guess.
It's one of my favorite observations was the fact that in areas where you have a high homicide rate, you have a low suicide rate, and vice versa. So the District of Columbia has one of the lowest suicide rates, but one of the highest homicide rates. And the theory,
why is that?
The theory behind that is that when you have all these external factors beating you down, you don't feel like it's your fault that you're depressed. When you're oppressed, when you have gang violence, when you have a lack of opportunity, it's other people's kind of factors and influence, versus if you're a highly successful individual, a bachelor degree, but your business fails, you take 100% of that blame. So it's all about perspective and an influence of our own devices.
You also mentioned the relationship between access to firearms.
Yes.
In the Rocky Mountain states. That's in these days, that's a political football for sure.
It absolutely is.
Do you know what the gun lobby says about that? Because they seem to have an answer for everything that, they're just as good as buying them.
I've seen two different data perspectives, and I guess it depends on which one you credit more. So there has been some research that has shown that increases in gun laws has not changed the rate of suicide, so that it just increases the rate of non or less lethal suicide. So people are going to try and hurt themselves in any way, shape, or form that they can find available. I've also seen research that has shown that having more restrictive gun laws has decreased the rate of suicide in the United States. It's very controversial. I do think that if you have somebody who has made statements or thoughts, that as a family member or friend, getting their guns away from them, you're separating bullets and ammunition from the guns themselves. Yeah. In some areas, the police and law enforcement will actually ask the person if they can remove firearms, which I think is a great thing.
Safe to say, though, that suicide is not a black and white issue. There's a ton of gray.
Correct.
And it's a very murky situation that you have to sort of meander your way through, which I'm getting the impression that's what you have to do as an investigator, as a behaviorist, intuition, lots of things. It's not so cut and dry. We're going to come back in the third set. Our guest is Dr. Meredith Stanton. She is a psychiatrist at First Health, and our topic today is suicide. We'll be right back. Welcome back to our final set of All Things Mark County, speaking with psychiatrist Dr. Meredith Stanton. It just struck me, we were just talking between the breaks, your discourse is excellent, very conversational, very relational, very engaging. That's got to be an asset for you in speaking with patients.
Absolutely. I think that one of my strengths is building relationships with patients, because without a relationship, you can't form trust. And then people won't be able to, or won't be willing to be honest with you about how they're truly doing. And so part of my job is building these bridges and rapport with people so that they feel comfortable talking about things that are uncomfortable. And actually, it's one of my favorite aspects of the job. I am an extrovert.
Yes,
I
you
love.
are. I can see that you are.
So I love talking to people all day, and I don't think I could be a radiologist hiding in a dark room. So seeing patients and then getting to see them over the long period of time and seeing when they're not so great and when they're fantastic is such a reward. And I really love my job and what I do.
You mentioned about working with people in the emergency room, and again, this is a layman's comment. When people come into the emergency room, they're coming in because they have a physical malady, they're sick, they don't feel good, they've had an accident. People come in and say, I feel suicidal?
Yes, absolutely.
God, is that right?
Yes, because it's a crisis, and especially their family members will bring them in. So an example would be is that you have a teenager who's been doing some self-harm, which is like cutting, which is more to alleviate stress, and then making comments to their therapist or their parent that I wish I could die. The biggest thing that we've noticed a trend in is posting to social media about thoughts or about our gestures. And so in a crisis, they'll come into the emergency room in order to be evaluated. And if a person is deemed being unsafe, then they will need psychiatric admission in order to address the underlying depression, mental health issue, substance abuse issue. And a lot of times, sometimes people don't want to be admitted to the hospital, and that's where in the state of North Carolina, we have involuntary commitment, that if it's deemed that they are imminent harm to themselves or others, that they lose their right to be able to make decisions about their admission, and we admit them to a behavioral unit, 24-hour care.
So that's the easy way to get you in front of people, but what about the
most people don't want to see me in the emergency room because then we know it's really bad situation.
So how do other people get in? How does that whole process work where they get in touch with you and set up an appointment?
Sure. So we are very fortunate in Moore County to have a very strong mental health community of providers. I came from Sumter, South Carolina, where we had 3.5 psychiatrists for 100,000 patients. Here in Moore County, I think we have about 21 full-time psychiatrists, and that's not even including social workers, counselors, and psychologists, nurse practitioners, PAs. So we're very fortunate to have the availability. Now, within the United States, there's a shortage. So I have a clinic. I love seeing patients, but sometimes it's hard to get in with me.
Right.
First Health does have a very good behavioral services clinic. The telephone number is 913-715-3376. We also have a triage clinic with one of our psychiatrists to kind of funnel people to the right providers. But Moore County also has Daymark, which is next to the hospital, which is part of the Sandhills Center, which is one of the state-funded mental health communities, if you don't have insurance or you're underinsured.
Right. So identifying and prevention. There must be people who would be listening who might be listening with an ear that says, this is important to me because of a loved one. But we're not sure. I don't know. Are they really at risk? We don't know. You encourage them to do what?
So if you ever notice the signs, and I want to kind of talk about the signs again, as somebody says they feel like a burden, they're isolating, they have increased anxiety,
right.
Unbearable pain, substance use, mood swings, feeling hopelessness. That's where you can do these 5 steps that are pretty kind of fundamental. The first one is ask. And that's, I think, is the hardest step, is to ask somebody, hey, I noticed that you're not okay. And that's where we come from a place of love and concern, to say, I noticed this about you. And then you follow up with a question, have you been having thoughts of wanting to die? That's a really easy way to kind of gauge a person. And a lot of times, basically, their reaction will be very telling. Sometimes people will start crying. Sometimes people will say, I've been feeling that way, and I've been afraid to say it out loud because it's a weakness, or they didn't want to be a burden to other people. So I think that's the number one thing, is to ask. The second thing to do is to keep them safe. That would mean is that you don't have to watch them 24 hours a day, but at least remove anything that they could hurt themselves with.
Uh-huh.
Firearms, sometimes sharp objects, access. A lot of people, the telltale sign is that they'll go and they'll buy excessive amounts of medication or hoard medication, so limiting their access to prescription drugs is important too.
Right.
The third thing would just be present, because a lot of times when they isolate is when people are by themselves that they tend to do more harm. It's very rare that people will do it in front of other people, unless it's one of these really sad murder-suicide kind of situations. The fourth would be to get them connected. And that means you can bring them to the ER, have them go to the primary care physician. A lot of times primary care are the front lines for mental health because it's easier to get in with primary care doctors and providers. But it also is that they have already established a relationship and like to talk to their primary care about some of their depression and anxiety. But also that means get them connected within the community. So this is where organizations within Moore County can reach out to people who are at risk, inviting them to do church functions, checking in on them. I love the fact that we have this organization and volunteers that will reach out to some of the elderly population that don't have transportation and ways to get around.
Right.
And I think connectivity, not on social media, because that's kind of a false connectivity,
Right.
but face-to-face connectivity makes a huge difference.
I couldn't agree with that more.
And lastly, check in, follow up with people. So I had a patient who was really angry that she was planning on hurting herself, got everything in a row, called her neighbor to say, hey, make sure my dog's okay. But the neighbor, being a responsible person, called the police instead. And then that person was the one who followed up with her after she left the hospital, because obviously she was very severely sick, and made sure that she had a whole group and gaggle of friends to support her. So it's like circling the wagon, that if somebody feels like they want to die, then we need to support them in any way we can.
How do you listen to people not by what they say, but by what they don't say?
I'm really good at discerning when people are not being 100% honest with themselves.
Right.
I'm a terrible poker player, but I can read individuals fairly well. And especially when they're not fully willing to engage in conversation with me, to kind of tell me what's going on, then that kind of piques my radar, and I'm like, ooh, this person is holding back, hiding. Why are they hiding?
Right.
We need to find out more. So that's where if we're lucky, we can get in touch with family members who can give us extra information about what they notice about the loved one. And sometimes people will be, untruthful with me because they don't want me to find out that they are having these thoughts, because they don't want to get locked away. Because it's scary. I mean, a lot of people have never been to a psychiatric unit, so they don't know what to expect. And the unknown is terrifying.
What about the services you provide to people after a suicide, the aftermath, the people that are left behind?
I think that grief counseling
Yeah.
is critical with whomever you can connect with, whether that is a pastor or a mental health professional, that dealing with grief is important. Grief is like any other kind of wound to our soul, that if we don't let it heal, it'll fester and never go away. And I think that loss because of suicide is so much more damaging and shocking and sudden that it is hard to process.
Can you share with us a success story, one that you look back on and realize what can happen when somebody can be brought out of and into another way of living and moving away from a suicidal place?
Yes, and that's a great point that I don't think that people really talk about, because we talk about the
Right.
ones that have
Right.
passed
Succeeded.
away.
Mhm.
Yes. So
Talk about the ones that have
yeah,
failed.
and those are some of my favorite patients.
Right.
Is that I had a young woman who had a lot of problems, who had attempted suicide multiple times, and she came to see me. This is when I was practicing in South Carolina, and I think that she had never had somebody who didn't judge her. Because a lot of times you see a provider and they already have assumptions or bias. And I really try not to judge anybody. It's sometimes hard. I'm very expressive, so a lot of people can read my facial expressions.
Yeah.
So we ended up having to send her to a residential facility for 6 weeks where she got really good intensive therapy, problem solving, and then was able to graduate from that program, go back home. And I started seeing her in 2012, and her progress along the way is amazing. She rarely has thoughts of wanting to die. Just because you have the thoughts here and there doesn't mean I'm going to say that you need to be hospitalized. And she knows how to cope with them. So when she has a thought, she uses distractions. She reaches out to loved ones. She uses good coping. Mm-hmm. And she's actually one of the patients that came from South Carolina and sees me in my practice now. And it's been amazing seeing her over a 6-year period of time.
So good coping skills suggests good discipline. It takes a discipline, doesn't it, to be able to administer that?
Well, I think it takes the 10,000 hour rule that no matter what, if you want to master something, you have to practice it in between times of crisis or in need. So God bless my children. So I try to instill good coping in my children now, so that when they have a hard or stressful day, they're able to verbalize it and say, hey, I need me time. And I say, okay, I'll give you me time. Or, Mom, it was a hard day. I don't want to talk about it right now. And I said, that's fine. And I try not to be a psychiatrist to my own kids.
And they're 8 and 5?
Yeah, I know.
So they're at that stage where they are going to communicate everything to you.
Yes.
They haven't shut down yet.
No, I don't. When they turn like 12 and 14, I'm not looking forward to it.
See you later. We'll talk to you in about 10 years.
That's when I'll be friends with all their friends.
Right.
And then I'll be like, hey, so what is your friend doing? That's a way to kind of, for parents to find out how their own children are doing, is asking about their friends. So you indirectly find out.
If people want to go online and read more information or anything about a hotline, where would you advise them to go?
That is a great question. So the National Suicide Prevention Lifeline is a great place, and you can actually chat. So if you don't necessarily want to call, you can go online and start a live chat with some of their suicide prevention individuals. And that's www.suicidepreventionlifeline.org. And the telephone number is 1-800-273-TALK or 8255. So that's 1-800-273-8255. And that is for not just people who feel suicidal, but also for their loved ones who need help.
And give me that website one more time.
Yeah, absolutely. It's www.suicidepreventionlifeline.org.
I got it. And one more thing, before, because we are winding down on time. If you don't have insurance,
yes.
What do we tell people who don't have insurance?
You can still come to any hospital or ER setting and be evaluated, no matter your paying and status. And part of First Health is that we have contracts with the state. So if you're uninsured, we will still admit you, because that is, one, the right thing to do, and two, it is a mandate. Then there's also ways to connect with Daymark and Sand Hills Center, which is the state mental health facility.
Okay. You're a very compelling speaker, and you're right. You probably wouldn't be a good poker player just by grading you as we're talking here and looking.
Thank you.
You have tons of great facial expressions, but you're very well spoken, and you have a great disposition. I appreciate you coming in to talk about this a little bit. It's a conversation that people need to listen to. Dr. Meredith Stanton, we appreciate the time, and hopefully look forward to hearing more about you down the road.
Thank you so much.
Yeah, and welcome to Moore County, even though it's 2 years old by now.
Thank you.
You were a pleasure. Thanks, everyone. This is All Things Moore County. Have a great week.